some drums there. So arrival for our guest of honor with Tuareg, the permanent secretary for the Ministry of Health, Professor Mwachisompola, and other dignitaries. Okay. Chipata Jango. Thank you very much. Thank you very much, ladies and gentlemen. May we be upstanding for the nation anthem. What we will do is that the instruments will play and we will also sing. Want to see how best we can sing the nation anthem. DJ. Proud and free, land of weak and joy, unity, victors in the struggle for them round. Freedom's bound, all one strong and free. Because it's our mother land, passion with and blessed by God's good hand. Let us all have people join us one, brothers under the sun, all one strong and free. Number one nation is our throne. Unity and peace divine sky. Like a noble eagle, wings fly. Zion, praise to thee. All one, strong and free. Bless our great nation. Free men we stand under the flag of our land. Zambia, praise to thee. All one strong and free. While maintaining our standing position, may I now call the one who's going to open for us in a word of prayer, and this is Mrs. Edith Banda. She is the planner at this hospital.
Shall we pray? Our Father in heaven, we are grateful this morning that we are a people and a nation that is called by your name. And this morning, as Matero, we recognize you as our God. And we pray that even as we start this meeting, we put you ahead of it. And we are praying, Jehovah God, that you be part of it and ensure that our plans go according to what we have planned. We speak peace as we proceed with the meeting, and we come against any spirit that may want to disrupt this meeting. For we have prayed in the name of Jesus Christ. Amen.
Thank you. We may take our seats. The guest of honor, the permanent secretary in the Ministry of Health, Professor Mwachisompola, the representative of World Health Organization, the area member of parliament for Matero, the district commissioner of Lusaka, represented by the district administration officer, the Chief Executive Officer for SIDAS, Dr. Izukanji Sikazwe, the Project Manager, 10 plus NCDs. I'm sure an activity we have come all to witness. Professor Faston Goma, directors from the Ministry of Health, the Provincial Health Director, the District Health Director, the Medical Superintendent for this hospital, Matero General Hospital, heads of government institutions present, representatives from cooperating partners and non-government organization, our Neighborhood Health Committee chairperson for Matero, the members of the community from Matero present here, members of the press, invited guests, ladies and gentlemen. Indeed, it's a happy occasion, very colorful. I can see from this corner here. Indeed, we'll be able to know more today about what Pen Plus is all about, but simply also to mention that we are talking about non-communicable diseases, and something nice is about to happen, but it's not my show today. And so allow me now, as I introduce myself, the Director of Programs for today, Kakoma Samdata, just to welcome the representative of the DC, the DAO, Mr. Chia O'Neill, to give us welcoming remarks. Shall we clap for Mr. Chia? He did indicate to me that it's not Chia, it's Chia. So I hope I pronounced it well. The Permanent Secretary of the Ministry of Health, Professor Lakson Asonka, the representative of the World Health Organization, the Member of Parliament, the CEO, Siders, the Project Manager, Pen Plus NCDs, Professor Faston Goma, directors from Ministry of Health, senior staff, Lusaka Provincial Health Office, the District Health Directors and the staff, non-governmental Matero Community Press, ladies and gentlemen, representing Lusaka District Commissioner, Mrs. Rosa Kayoni Zulu, who is attending to other equally important duties. I'm O'Neill Gia, District Administrative Officer, Lusaka District. I'm pleased to welcome you, guests of honor, and all our distinguished invited guests to Matero Level 1 Hospital at the official opening of the Pen Plus Project Non-Communicable Diseases Clinic. Allow me to begin by expressing my gratitude to our cooperating partners for their tireless concerted efforts in establishing this important and timely project. I acknowledge and thank the leadership, members of staff, and the people of Matero community for hosting the Pen Plus NCDS pilot project launch today. I understand the project is a World Health Organization package of essential NDC interventions, and it aims at decentralizing the provision of care for such conditions where traditionally services are only available at tertiary referral facilities. On behalf of my people of Lusaka District, I would like to register our gratitude to the New Dawn government and its partners
for selecting Matero Level 1 Hospital to be one of the pilot sites for this project. With a population of about 3 million, which is equivalent to the population of about 11 ordinary districts, Lusaka district deserves special attention with regards to all forms of service delivery. I'm glad that the district was not left out in piloting this important project. My humble appeal is that even when the project will be rolled out, Lusaka must have its appropriate share of the intervention. Thank you very much for allowing me to make a statement as I welcome you to Lusaka district and Matero First Level Hospital in particular. Once again, you are welcome to this place. May God bless you.
Thank you very much. That is our district administrative officer. He did pronounce his name well. I think for the sake of the guest of honor, I will not attempt, just in case he hears another name that he did not hear earlier on. The guest of honor, distinguished invited guests, again, allow me now at this point to invite the principal investigator, Professor Faston Goma, to give us an overview of this 10 Plus project. Professor Ngoma.
Hello. Good morning, ladies and gentlemen. Good morning, guests of honor. And could I welcome the high table and all colleagues here this morning. We would want to welcome especially members of the community, which make us comfortable to note that we are welcome in Matero and that Matero is appreciating our services. Thank you very much, District Administrative Officer, for those remarks. It just assures us that we are moving in the correct direction. 10 Plus is all about a package of essential non-communicable disease interventions that are supposed to be put in place within the primary care facilities the world over. This is an initiative of the World Health Organization, and so we are glad that the WR for Zambia is here, Dr. Bachiaita, to see how well we are interpreting this. This is, to us, one challenging field in that when we talk about non-communicable diseases, more chronic diseases, long-term diseases. The main problem is that they don't pay. And you know, Africans are paying. If it doesn't pay, it's not a problem. Until the day when he can't breathe or he can't walk, then he must be brought into hospital. Then it's too late. We are hoping that by this particular service, we are going to reach out to those people who have non-communicable diseases and need them to be either stopped, reversed, or at the worst, controlled, so to say. And so we have in Zambia the Non-Communicable Disease Commission, which has been looking at priorities for this country. And that commission brought out 10 conditions that we must be looking at, and we are looking at those conditions here. I would want to recognize the presence of my colleague, Professor Wilbrod Mutale, who is doing 10 as it is supposed to be done at primary care level. He is looking at the delivery of these services at small health centers and health posts, more looking at the community, seeing how we can do things there. 10 Plus is about us now looking at more severe non-communicable diseases. And that is why we are glad that this has started at this particular level of healthcare provision. So here we are talking of severe hypertension with complications. We are talking of stroke as a result of hypertension. We are talking here about heart failure. These conditions which ordinarily are supposed to be treated at UTH, we say Matero can actually have them treated, and even here treated by well-trained clinical officers and nurses. And I think that's a very, very big plus to service provision. We are talking here of not only, diabetes, as we always know it, being, the raised sugar, which is controlled by diet or by tablets, but here we are looking at more complicated sugar disease. Again, conditions which are supposed to be treated at UTH, but here we look at complicated type 2 diabetes and insulin requiring diabetes. And I'm sure you will soon note that you don't have to go to UTH to get your insulin. You can actually have it obtained from here. And such conditions. So in all, really, we are trying to bring services closer to the people. And that is why we are glad that DC has welcomed us so warmly to Matero. In our dealing guest of honor, we did say to our colleagues that while this service may be more convenient in a place such as this, which is serving an urban population, we are also concerned about what is going on in rural areas. And we always thought NCDs were diseases for the rich, but I think we all now know that even the poor suffer from these diseases, and the poor suffer from them more severely. And that's because of the problems that they tend to have, most of which is access to services, diagnostic and curative. Guest of honor, we have been open now for 4 months. In these 4 months, we have enrolled at Matero 350 patients in the different disease conditions. But we also took Mwachisompola, which is level 1 hospital for Chibombo district, to try and see whether we could be relevant in the rural area. And the guest of honor, I'm glad to report that we have enrolled just over 150 patients from Chibombo already. So in 4 months, we have more than 500 patients on our registers who are being followed up and who are being treated. So far, we should say that we have had a lot of cooperation from the communities. We are learning a lot of lessons from what our friends in the HIV world have been doing, especially when it comes to follow-up. Patients coming for reviews, getting their drugs and making sure that they're not off treatment. And so far, we have lost nobody to treatment. I think a big hand to the community and to the people who are getting to us. Everyone has come for their medicines and they have been on treatment. Soon we'll be reporting on how well we are doing when it comes to control. And it's also good to note the way we have treated these services within the ongoing services at this hospital. And that's why we're glad that you are here to open this clinic just to see how it's fitting in the usual outpatient department of Matero Hospital. So we are not asking for more additional infrastructure. We are not asking for more space. All we are asking for is more training of the available health workers. And we can say that through what we've done, we know that the health workers you have at Matero are well motivated. They are keen to learn and they are keen to offer the service that they're supposed to be offering. So in all, I think we have done well so far. And we hope that with this official opening now, the community will know that they can access some of those services which they have been accessing at UTH here, and they can rest assured that they are in safe hands because the people looking after them here are well trained. They are also in safe hands knowing that the hospital here will do everything possible to make sure that the supplies are kept at good stocking levels We are trying our best to make sure that they have all that it takes to treat those conditions which our people are living with. And guest of honor, I should just say, welcome to the Pen Plus clinic this morning, and we are looking forward to you opening this clinic and for the community to know that we are here for the long haul. This is not a project, this is a program starting under this hospital and is here to stay. We want everyone to access these services and to benefit from them. Thank you very much, guest of honor, and welcome. Thank you.
Thank you, Professor Goma. Indeed, you can see the professor unpacking that package. And towards the end, he said, it's not a project, it's a program. He said, oh, this must be a professor. Because I kept saying project. It's now a program. And a program looking at severe conditions, severe NCDs, and some of them have been highlighted. I took note of heart failure, severe hypertension, indeed some complicated sugar diseases as we know them, the diabetes. Of course, being an expert, he was going to give us type 1, type. For me, I went there with my little knowledge, simply sugar disease. Thank you very much. At this point, guest of honor, just to break off from some more speeches which are yet to come, allow me to call Chipata Django Theatre Group with a dance called Vimbuza. I did ask what it meant. They said it is spiritual. It's spiritual. He said, no, healing. I said, okay. I hope it's healing in the medical field. So Vimbuza, thank you. Yes, thank you very much. The challenge is indeed resonating well with preventing NCDs. When the professor went there, somehow my mind told me he would throw even a leg this side and then this side. But when I looked at the list of those NCDs, I'm sure I was saying they are injuries. So thank you very much. He knew very well and understood why we are here. So he will not attempt to do that. And please, if you can't, don't try this here. Maybe try at home. Thank you very much. We'll continue with the remarks. At this point now, allow me to call upon the Chief Executive Officer for CIDAS to give us the speech.
Thank you so much. Good morning, and I'll write on the protocols already delivered earlier this morning. I'm Ms. Sikas with CIDAS, and I'm really humbled and really excited to be here to represent CIDAS, the Center for Infectious Disease Research in Zambia. As you may be aware, we're the largest health research NGO in the country, and our role really is to support our government's public health priorities. Our vision as CIDAS is a healthy Zambia, and I think this program, not project, program is really working towards a healthy Zambia. We support government's public health initiatives, and in this case, our role has really been to facilitate the Pain Plus project or program. Our role has been to support Professor Goma and his team to do the remarkable work that they've been doing here at Matero First Level Hospital, as well as Mwachisompola. And this has been made possible from the generous funding and investment from the Leona and Harry Hensley Charitable Trust. We would like to recognize them and thank them for their confidence in CIDAS to be able to handle the finances and the responsibilities that come with ensuring that this program is a success. With this funding, we've been able to help Prof. Goma and his team set up the 2 sites in Mwachisompola and here. And these are focusing, like he said, on those NCDs that sometimes we forget about. He mentioned a lot of them, but I want to mention mental health diseases. I think sometimes we take mental health, especially in our culture, as very lightly or something that can be easily overlooked. But we're focusing on mental health diseases as well, especially amongst our youth and adolescents. We're focusing on chronic lung diseases. So lung disease is just not tuberculosis. There are other lung diseases that we have to focus on, and Prof. Goma and his team are doing that. Despite the many challenges that we've had in setting up this program and some of the delays, and we apologize for that, some administrative operational delays on the part of CIDAS, I think we've been able to successfully get up and started. We've been able to train nurses and clinical officers, and I'd like to recognize the qualified doctors from UTH and other higher training institutions that have facilitated the trainings of the nurses and clinical officers in all the different didactic as well as on-site mentorship and support to be able to handle these NCDs. With the support from our generous funders, we've been able to procure at least 4 ultrasound machines, 4 international normalization ratio machines, as well as 4 ECG machines. And I'm really happy to hear from this morning, PS had said that they'll be getting additional support in this size to support NCD care. Our work would not have been possible without the support of the communities, and I'm really glad that somebody from the district commissioner's office was here to represent community. So we're truly grateful for community and their participation and support of the work that we've done. As Prof. Gomez said, a lot of lessons are there from the HIV field, a discipline that I'm passionate about and I spent quite a bit of my career working in. And I trust that this hospital and other hospitals as we go forward will leverage off what we've been able to successfully do with chronic care and HIV and leverage those experiences and good lessons and attribute them towards these other NCDs. Yes, with those remarks, again, I want to acknowledge the support that we've received from your ministry. It has not been easy to be a non-profit organization supporting the health agenda in these socioeconomic times, but I think your ministry has always been on hand to facilitate and to encourage us and to guide us as we continue towards our vision of a healthy Zambia. Thank you for listening to us, and we wish this program the most success, and we look forward to supporting and facilitating other researchers, investigators that may want to make use of the CIDES platform. Thank you so much.
Thank you very much. That was Dr. I have to again be careful here. The other one is Kazwe, but is Ukanji. I hope that's how it is pronounced. Thank you very much. And guest of honor, just allow me, and indeed apologies for that, to recognize Mr. Mukupa, or Honorable Mukupa, who is our area councillor for this place. Is also with us. Again, thank you for being with us, Honorable Councillor. Thank you. Now I'll call on the World Health Organization country representative, Dr. Nathan Bakaita, to give some remarks.
Thank you so much, Director of Ceremonies. My name is Bakaita. If you call somebody Bakaita in my culture, they will box you. Okay, so my name is Bakaita. So our guest of honor, Professor Lakson Kasonka, allow me also to just ride on the rest of the protocol that has been given. So good morning, everybody. It's a great honor for me to join you this morning to witness the opening of the package for essential non-communicable diseases intervention plus clinic, or PEN plus clinic, here in Matero Hospital. As we all know, Africa has a high burden of NCDs, with the proportional mortality due to NCDs ranging from about 27% to 88%. The problem is compounded by the fact that we have a weak capacity for early diagnosis, management, and care of NCDs, leading to this rising mortality. If we leave it unaddressed, we'll worsen health inequities and undermine the ability of our states to attain SDG 3 target on reducing premature mortality from NCDs. So provision of healthcare services for these severe NCDs, like Professor Faston Goma has mentioned, has often been occurring at tertiary facilities in most countries. And because not everybody has access to these tertiary facilities, it means that they have their condition not managed properly, and therefore exacerbating health inequities and also contributing to high premature mortality from NCDs in the region, thus hindering our progress to achieving what we call universal health coverage. Now, ladies and gentlemen, since 2008, WHO has been providing support to member states to implement this package, which we've called the WHO PEN+, with the aim of providing services that are decentralized close to where the people really live at primary care level, as well as to ensure that even at the primary care level, where they're being managed, in case the conditions are beyond the capacity of the health workers at that level, we also promote referrals to other levels. So I hope that the work Professor Mutale is doing is very well connected to the work here, so that when people cannot manage the conditions there, they know where to refer to. Already in our discussion this morning, where we're being brief, we're informed that people come here and when their conditions are beyond the capacity here, then they could be referred to the heart hospital in case they have problems. So it's important to look at the whole system. Yes, you are decentralizing to the lower levels, but also make sure that the intermediate and tertiary levels, their connectivity, so that the patient can be managed according to the level that they require. Now, this strategy, like Professor Goma has rightly spoken, is aimed at improving capacity at the primary care level. So we are so glad to witness today an example how to roll out WHO 10+. You know, at the level I work, we come up with all these ideas. We think countries should do this and this and this. And for many of them, they just keep the reports and all the guidelines and put them away. But it's so gratifying that here we're implementing something that has been proposed although a long time ago, better late than never. We are pleased that the health workers here have responded very well. The community response is great. No wonder the numbers are climbing. In just 4 months to get those numbers means that the community has taken this on board. But also what is so good about this project is that, this program. What is good about this program, all right, not project, all right, is that they have shown us that by simple adjustments of a clinic layout, training the same staff you have, and providing basic equipment can bring services closer to the people. And when you provide a good service, we've also heard that reports have gone to Chipombo and people from very far are also coming here. Yet there is Mwachisompola, is it? And so on. Meaning that the service is good and yet has been provided not with such huge investments and also will be sustainable in the long run. So we hope that we can document the lessons learned here and the best practices so that we can roll them out to the rest of the country, but also to the region at large. So on behalf of WHO and other cooperating partners, we want to pledge that we will continue to provide leadership in mobilizing the international community to support such initiatives. We will also continue advocating for increased resource allocation to support the implementation of this 10+. We also hope at a higher level to support member states to improve the affordability and availability of essential medicines, diagnostics, and monitoring devices for chronic and severe NCDs, and also to promote more partnerships that will be able to improve the training and expertise of health personnel and to undertake research, which is being done here as it is being implemented. So I want to recommend, so ladies and gentlemen, let us hold hands and work together so that we provide the world's most vulnerable with accessible and affordable healthcare for chronic NCDs. Through this integrated delivery model, we can bring life-saving care to poor rural areas and accelerate progress towards universal health coverage. So with those words, I want to say God bless you all and God bless our beloved Zambia. Thank you.
Thank you very much, Dr. Bachaita. And then I can mention the easier one. The easier one is very easy. Thank you, and we appreciate lovely indeed remarks. The guest of honor, allow me again at this point to just invite once again Chipata Jango Theatre Group to give us a small pause, very short sketch. Chipata Jango Theatre.
manje so sure angangana kanzo nimteko kuna inebaso mikazo kwa nyumba sangala izi na mwana odwala sure analimkomeza sisi aenda leo akapela azazi leo tamba akapela mwana watu odwala ama bakuni tima mkomela mnyumba ebe kwa mela siku zilika ina sasa chisoyo usiku leo skeleti kwa mai wake sisi na mkazi wake ati iwe aliyesa na mai wake aliyesa na mai wake manje mbele na wewe sasa sorry mbele wake ila bado kusilisira nanga jana wachetwela kapata kwa mnusu waenda wewe waenda ona makeni mwana mwana ama fitina tena mkomea nyumba iwe ndio kupatia utuslana nila wana wamsia waenda wewe waenda market hapa aenda futa tumkini akuta bonga kama plus kulipita basi Shuka
I was wondering where that name Django came from, but I think you have demonstrated. Thank you very much. That was a Django theater. I can see that they really understood 10+ program. At this point, allow me to call on the district administrative officer to once again come, and this time to invite the guest of honor to give his keynote speech. Mr. Gia. Thank you. We can clap for him. Gia. CHIYA. Guest of honor has a simple task that of requesting you to address the gathering. May you kindly come and deliver your speech, sir. Thank you.
sit down. Mr. G here. It's quite a complicated name, isn't it? With your permission, I will remove my mask so that we can interact more closely. But I want to give credit to the administration in this hospital, because when I just stepped out of my vehicle, I realized that everyone was donned with these masks, and it reminded me that we're still taking precautions, understand that COVID is still not over. And the truth of the dictum, COVID will not be over anywhere till it is over everywhere. We still know that there are pockets, there are spaces across the globe where COVID infectivity is still high. And so we commend everyone who remains conscious to understand that COVID can easily fly into Matero and again push us back into those moments when we had to put up with the high infectivity, and I think the rest is history, and I don't want all of us to spend a lot of time thinking about that. I commend the Jungle Theatre. I think that was quite a fantastic performance, and I would request all of us to give them another round of applause. The sketch was very informative and really descriptive of exactly what the 10 Plus is here for, and it's gratifying to note that the Jungle Theatre, who are members of the community for which this important program is intended, can be able to quickly pick up the information, and we can use them as an important medium to communicate what we're trying to do today. I want to recognize all of you that are here this morning. I pay tribute to Mr. G here and the office of the district commissioner for welcoming us so graciously to Matero, to Lusaka district, and permitting us to perform this important function this morning. I note the presence of the area councillor, and thank you for your leadership, for your political leadership that you continue to provide in this place. Dr. Nathan Bachaita, my brother, my colleague, the representative of the World Health Organization office here in Lusaka. I take note of the presence of Dr. Izukanji Sikazwe, the Chief Executive Officer of CIDERS, the Principal Investigator, Professor Goma. I also recognized Professor Mtale, who together has invested a lot of time and effort and knowledge and commitment into the success of what we are starting as a 10 Plus program. The leadership of this hospital, the medical superintendent and the representative of the district health officer from Chibombo. I also recognize all members of the Ministry of Health that have escorted me, that have come here with me to come and facilitate this important occasion. I very importantly recognize the hardworking members of staff of this hospital, the nurses, the medical and clinical officers, and just encourage you to soldier on. The Minister of Health sends her best wishes to all of you. She sends her greetings, and she's absolutely cognizant of your commitment to duty, your efforts, and that extra mile you are able to go in sustaining the functions of this very important facility. The expectation upon you by the members of the community is extremely enormous. and the minister is under no illusion that you are not doing your best to meet that expectation, given the size of the population that you serve, the disease burden in the area, just to show how much work you are able to put up with in containing and sustaining the health of our people here. Of course, I'll be doing a disservice to myself if I didn't recognize the enormous role of the members of the press, the media that are always with us wherever we go, for disseminating that information about the work we are trying to do as a Ministry of Health and as a government in general. I am extremely overjoyed to be here this morning, and I want to thank the administration of the hospital and the 10+ team for according me this opportunity this morning to come here and be part of this very momentous occasion. Today, this morning, we are here to launch the package of essential non-communicable disease interventions clinic, otherwise known as the 10+, at this great facility at Matero First Level Hospital, and also at Mwachisompola First Level Hospital in Chibombo. As we are all aware, the health of our citizens has been given high priority by this government, the new Dawn government, and the President of the Republic of Zambia, Mr. Hakainde Hichilema, who is very committed to improving access to healthcare by all our people. The Minister of Health has a vision, and this vision is to see a Zambia in which all our people have access to quality healthcare, a vision that says that all our people enjoy the best possible health so that they can contribute to the social, economic development of our lovely country. So the 10+ is an integrated delivery strategy for chronic care of severe communicable diseases, otherwise popularly known as NCDs, at intermediary level facilities such as our district hospital here. This is a build-up on the World Health Organization's package of essential NCDs interventions for common and non-critical, non-communicable diseases. Distinguished ladies and gentlemen, the disease burden in this, our country, is currently transitioning from epidemiologically from infectious diseases. That is, from those diseases that we know very much and very well about, the infectious nature, the infectious type of disease like TB, tuberculosis, TB, malaria, HIV, and lately COVID, to non-communicable diseases, the 10 that the Professor Goma alluded to. These are the hypertension, diabetes, heart disease, cancers. And this has created a double burden of disease. So we are constrained with infectious diseases and non-infectious diseases, which are chronic in nature. So this is the burden that our ministry has to fight and put up with. We have to draw resources and contain these two categories of health challenges with equal measure. Previously, it was believed that non-communicable diseases, NCDs, like Professor Goma mentioned, were diseases of the affluent. We also believed that these are European diseases, but you can see that with time, our lifestyle continue to improve and the living standards equally are improving, simulating those standards that we see with people elsewhere in developed countries. So accordingly, we remain and become vulnerable to these diseases of lifestyle. So as a primary cause of disability and untimely death in our countries like Zambia, that is in less developed countries, NCDs are quickly displacing infectious diseases. You agree with me that we've done so much work on malaria that slowly malaria is becoming less and less much of a public health problem. We're going to do so much more on COVID, though COVID will still be around, but we will be able to stay control of COVID. That's how much progress we're making with infectious diseases. But we still have to deal with the non-infectious diseases, which is the NCDs, and which actually is the reason for high kind of loss of time from productivity. Hypertension, diabetes takes away a lot of our people from productive engagements, and we don't realize how much that is taking away from our economic development. So during the first nationwide household NCD STEPS project that again the principal investigator mentioned, a survey was conducted in 2017, and it was established that 20.5% of men like myself with high blood pressure were found with high blood pressure. I'm hypertensive myself, and I think many men in this audience are. These days, when I ask anybody my age and whether they are not hypertensive, I get surprised. So why? I do. Given the job I've done, given the commitments and assignments we've had by the time we come to this age, it's just no way we shouldn't have high blood pressure. And that should be taken as normal, because that's how it is, and that's how this disease comes by. And there are those men who are shunning and staying away from health facilities with fear of just getting a sphygmomanometer to determine how much blood pressure they have. They say, no, you might find it high, and they'll start taking medication. What's wrong with that? Okay. So 20.5% out of that study identified that 20% of our men were hypertensive. And unfortunately, 91.5% of those were not on treatment. Either they didn't know they were hypertensive, most likely, or if they did, they thought that treatment is something else, including, I've heard one man tell me, no, you treat hypertension by drinking lots of water. I drink 5 liters of water every morning. Look at that. Okay. Further, in the same study, for women, I've talked about men because I am. Let's talk about women. In the same study, 17.6% of them, 73% of women, 17.6% of women were found to be hypertensive. 17.5%. Slightly less than men, but 17.5% of women is a big number to be hypertensive. And again, age-related hypertension should not be stigmatized. In fact, when you uncover hypertension, be happy about it, because that can be treated. Again, and unfortunately, out of all the women that were identified as hypertensive, 77.3% of them were not on treatment. Again, these are those who either did not know they had hypertension, or they believed in other alternative less effective methods of treatment. Water, because they say water is life. So they will gallop tons, liters and liters of water a day, hoping that will solve their hypertension. Yes, we're a Christian nation and a very spiritual people, and prayers do help, but that's not enough. Okay? Treatment for hypertension involves not only prayers, but treatment for hypertension, as you will come to learn from the pain class. So, in addition, 16.3% of men and 32.5% of women in that study, in the STEP study, were found to be overweight, obese, let's put it that way. Again, I've alluded to the fact that the lifestyle is changing in Africa, particularly in urban areas where we sit right now, that with sedentary lifestyle and much less of physical activities, we are rather getting excess weight. And all these are recipes to chronic disease, including hypertension, diabetes, and other non-communicable diseases. So you can see that the obesity continues to be a problem in our community. Obesity is labeled as malnutrition, because again, malnutrition has got double edges. It can look at undernutrition and overnutrition, oftentimes overnutrition leading to excessive weight gain. Obesity, as you may know, is one of the major risk factors, like I said, for diabetes, for cardiovascular disease, and it presents substantial challenges, physical challenges in individuals with this burden. So these figures I've mentioned are not only alarming, but they call to urgent action by all of us if we have to ensure that we reduce premature death, premature mortality from non-communicable diseases. Sadly, again, the majority of patients with NCDs, including high blood pressure and diabetes in our country, present to our health facilities late and often in advanced disease, which makes it, of course, very difficult to administer timely and appropriate therapies. So the essence of the Pain Plus project is to bring these services as close to our people, to the community as possible, so that we abate this tendency of late hospital reporting and late diagnosis of these conditions. So consistent and accurate health education, like we've heard from the Django sketch, health education and comprehensive healthcare services at the primary level, which is where we are now, has become extremely important for us as the best way to resolve these life-debilitating NCDs. The government is pursuing a decentralization model of governance, and this includes healthcare. We heard from the speech, from the sketch, that the initiative of the Pain Plus coming to Matero and not to UTH or Levi Monowasa is to bring this service very close to the people so that we don't have to take a bus and spend all that bus fare to go to UTH to get the blood pressure or the diabetic checked. We know that a lot of us in this community in Matero are moving about with skyrocketing blood pressures, where cardiovascular or strokes are a rule. That we as men, first of all, have a very bad health-seeking behavior. That it has to take serious pain before we can think of going to the hospital. Because as long as we don't get the pain, like Professor Gama says, we are fine. We men don't come to the hospital till it's very, very late. So the idea of bringing this healthcare package that focuses on NCDs is to bring this service very close to the people, so that even those that have got bad attitudes towards the healthcare will have no reason, will have no distance presenting itself as a barrier to access for this care. So that's why this Pen Plus is here. And this Pen Plus is going to be rolled out to many other facilities, similar to Matero Level 1 Hospital. So, ladies and gentlemen, our commitment to the cause of NCD has been exemplified in our support and dedication to the development of the Zambia Non-Communicable Disease and Injuries Commission report, which was launched last year in 2022. According to that report, some of the gaps leading to the high burden of NCDs in our country included inadequate health promotion and disease prevention interventions. It also highlighted the inadequacy of equipment in our healthcare systems, enough to respond to the growing burden and limited representation of people living with NCDs in the response. However, in bringing the identified gaps, our government, through the Ministry of Health, has among other things, implemented the National Health Insurance Scheme, which requires everyone in the formal and informal sectors to make monthly contributions to the authority, to the NEMA. And this financing model has provided additional resources for the delivery of improved quality of healthcare and services. The NEMA is very active here at this hospital, and I will implore all of you that are not yet subscribed to subscribe, to enroll. Let's go out in the community and encourage all those that are eligible to subscription, so that that funding we put together in solidarity can work for us at the time of need. Time of need is that time when we are sick and we need to come to our hospital here and get the service. The funding coming from NEMA will empower our management to provide all that they require to meet your healthcare expectations. To ensure that with medicines, I know today, and I'm responsible, but this topic is about the lack of medicines in the hospital. But I can assure you that this issue will be resolved very soon, and we shall have all the medicines that we require in the hospital. But I want to emphasize the importance of NEMA, that contribution will assure not only the availability of all the medicines that we require, but to ensure that this hospital is clean. And I'm delighted and impressed with management so far for doing their best to keep the hospital clean. But we can do, and we're going to do more with more funding coming through NEMA. That we should be able to provide meals for the patients. We'll be able to provide a clean bed with clean linen. We'll be able to provide surgical care most efficiently through this financing mechanism, through NEMA. I know as government will still be there, the Ministry of Finance, Ministry of Health will continue to provide grants. But what we want to see is that we, our people, take responsibility of our own health, but by when we are not sick, putting a little bit of money as a contribution to NEMA, so that that money comes to work for us in a way that we want the healthcare system to take care of us in the time of our sickness. So, indeed, our government cannot work in isolation and requires the support of cooperative partners and CIDers, WHO, and many other such developmental partners are always with us, and they pledge to continue to be with us in supporting all our initiatives and efforts. The PEN Plus is one case in point that is being supported by CIDers. As you heard, CIDers has been around with us for many years and is going to be with us to support health research so that we are able to develop best practices towards healthcare. Further, the government is working in collaboration with many other institutions, and we are grateful to the funding coming through the Leona M. and Harry B. Hans, the charitable organization, who cast their sight at Zambia and see how they can continue to help our communities by providing the necessary financial and other resources towards improvement of healthcare. So it is also our sincere hope that we'll continue to collaborate and partner with many other well-meaning and well-intended partners so that as government will continue to fulfill the expectations of the people. This government promised provision of quality healthcare, and quality in the sense of the word of quality. A healthcare that assures equitable access, meaning everyone who's got a health challenge and health problem gets the deserved attention and care as and when they need it, irrespective of their socio-economic status, except that they are Zambian. So, ladies and gentlemen, you may also be aware that in 2022, ministers of health gathered in Togo, in Lome, for the 72nd session of the World Health Organization Regional Committee for Africa, during which the PEN Plus strategy was adopted. This was adopted as a regional strategy to address severe NCD conditions at this level of care, at primary level care. I reiterate that this program is being launched at this level of care, not at that level, UTH level of care. So this strategy seeks to encourage district hospitals and other first-level referral facilities to build capacity to be able to diagnose, to be able to manage, to be able to care for NCD patients early enough. As you know, this is a silent killer. That's what we heard. NCDs are silent killers. That's what hypertension is. That is what diabetes is, because it's not painful. By the time it becomes painful, it's a stroke, and it's fatal and probably not reversible and causes death. So the strategy is to bring these capacities for diagnosis and treatment at this level of care, at primary level care, so that we can easily pick it, we can easily take action upon it, and we can easily control and cure it. So currently, most severe cases of NCDs in our country are being referred to UTH, to Ndora Central, to Kitwe, Teaching Hospital, and sometimes being referred abroad. This, I must point out, exacerbates the health disparities by putting this kind of care out of reach of those people. Imagine the people in the rural areas who have no direct access to UTH and to similar third-level hospitals. Yet they are Zambian and equally deserving for care because of their hypertension, because of their heart disease, because of their chronic pulmonary condition. So the Just behind decentralization is just that we devolve healthcare decisions to the community through the primary healthcare model, so that we don't leave anyone behind, that we really fulfill the commitment to universal health coverage. And as such, that's the best way to prevent complication of these conditions which Professor Goma said, unfortunately, can only be controlled, if not reversed or eliminated. We need to prevent strokes. We need to prevent comas arising from uncontrolled diabetes. Our hospitals, unfortunately, our district hospitals and local health centers across our country for now are yet to be adequately capacitated with equipment in order for them to be able to manage NCDs. And this is our commitment as the new government. This is my commitment as a permanent secretary for her, that we roll out capacity and make sure that our population within reach of this very important life-saving care of our patients. The strategy motivates us to implement standardized interventions to combat chronic and severe NCDs by ensuring that necessary medicines, technologies, and diagnostic equipment are available and accessible at the districts, because from here we're going to have to roll out to all similar level of care so that capacity is built. Again, this is in response to the decentralization model that I've just talked about. So, ladies and gentlemen, please allow me to make an appeal to our very dedicated medical staff here at this hospital, and I mean everyone that is working here, not only the medical teams, the support staff as well, that we embrace this program. It is not a project. We embrace this program and own it. We have complete buy-in, because yes, this program is here to stay, and yes, this program is ours. This program is not Professor Goma or Professor Mtale's only. It's ours. We protect it, we sell it to the public, the major beneficiary of the service that's being provided by the paying class, so that we improve it further. The program brings lots of benefits in terms of capacity building, in terms of raising the profile of this great institution. It will open our eyes as Minister of Health and see that something big is happening at Matero level 1. And as such, we'll be able to make biased decisions, big decisions towards this center, understanding the tremendous amount of work that is going on. And those decisions will include better support for the hospital in terms of human resources, in terms of supplies, in terms of just support, knowing that something big is going on. So this is not a project that belongs to a small clique of people. It's a project that should be sold out in the community so that it gathers the necessary support. Because the results obtained from here will be extrapolated to elsewhere, and Matero will remain as a mentor to those best practices that will be rolled out through the learning we shall obtain from this project to other centers of similar size across our lovely country. So I want to motivate you, the members of staff. I know a lot of times our staff have never been told how great and how much work they are doing. All they have been told is how much they've let their community down by not doing what is expected of them. I know I'm a physician myself, and I know over my practice how many lovely, great things I've done, and how much less of accolades and praises I've received out of that, against how much demonizing and backlashing I've received for just one omission out of what is expected of. But I guess this is the kind of job we chose to do. And sometimes you say it's a thankless job. No, it's thankful. God is there to see and thank us and seeing all the good things that we're doing. But I can assure you from the Ministry of Health standpoint that the minister may say this, but at the back and closed doors, she's extremely thankful and grateful about all that we're putting in, understanding the challenging environment oftentimes that we are performing our duties upon. So I can only implore you to continue putting in your best, and assure you that as we go by, lots of things will get better, the working environment will improve, and you will definitely start to get recognition and words of gratitude from the people that we serve. But most of all, God is always on your side, and thanking you for everything that you are doing to serve our people. Lastly, I want to implore members of the community and say non-communicable diseases can be avoided. And that's the best way to treat them, to avoid them. And our medical staff have been equipped with the information to share with the members of the public on how best to avoid some of these non-communicable diseases. The members of the sketch, the jungle, had started it, and you can see that there's been transfer of information very adequately to members of the community through those sketches to indicate that smoking is one of those things that can mitigate. Excessive alcohol intake is one of those. There are many other things we should take within our communities to help reduce the incidence of non-communicable diseases. And we, the medics, have got that responsibility to continue that medical education that the members of the jungle group recognize that the nurses and the doctors at this great institution are already doing. So I'm extremely delighted to be here this morning, and I bring the same feeling for the minister, and just implore all of you to support this very good initiative through the PIN Plus. That now is a chance and opportunity for us to push back or worse control these non-communicable diseases that are silently not only reducing from productivity, but constantly taking away the lives of our people. Okay. Yes, we are losing lots of lives through strokes, lots of lives through these non-communicable diseases, which we have a power to control and just improve the life and prolong the life expectancy of our people. So it is, for me, a distinct honor to be part of this very auspicious occasion this morning. And I just want to thank all of you for embracing and being part of this occasion, knowing that you will carry the vision of this program for the bigger benefit of all the people, not only in Lusaka, but all the 20 million people across this country, a fraction of whom are today affected by various types and the severity of non-communicable diseases. So it's my distinct honor and privilege to be here this morning to declare the Matero first level and Mwachisompola first level hospitals, 10 plus NCD clinics, and pilots. I don't think that these are pilots. We're here to stay. We are programs. We're not piloting. We've come to work. So I'm delighted to launch these programs on these two sites officially open. I thank you for your kind listening.
Thank you very much. That was a keynote speech from our guest of honor. A lot has been said and appreciated. And indeed, it's a happy occasion. As the guest of honor was speaking, I was looking to my, is it left or right? When I stand like this, it's right. This side is left. There are some exhibitions there concerning some of the health promotion messages and the nutrition. Let me just say the foods or nutritional messages as well that can be given to the people that are severe or that have severe conditions, the NCDs. So at some point, everyone will have a chance to be able to pass through those tables. For now, let me just make a few announcements on how we proceed. From now, the medical superintendent will lead our guest of honor and the high table, just the high table, and they will use that way, go around to the clinic site for the official opening, which has already been done, but cutting of the ribbon. And then we'll find the Jungle Theatre Group waiting. They will have a special dance before they present the knife. They said they will act today as knife girls or knife boys. So that will be only for the high table to see. The rest of us, we will wait here. And after that event is done, it's a short event. It will not take long. We will come back, and there are two beneficiaries. We heard that sometimes we are not appreciated, but there are two beneficiaries who would want to give vote of thanks, beneficiaries of this program. The age difference has also been considered, so you will get to hear what they have benefited in the short vote of thanks and the photo session thereafter, and then the program would have ended with a national anthem and prayer. So for now, allow me now to invite the MS to lead the high table to the clinic site. The DJ can play us some slow, nice music as we do that.